All of you, can you see the screen?
Yes, ma'am.
Yes, ma'am.
Okay, okay. Actually, there is so much of network problem in my place. Okay, yesterday, what did we discuss? Yesterday, Evagina, what did we discuss yesterday?
Clinical features of UTI.
Clinical feature as well as what? Clinical feature as well.
Ma'am?
Clinical feature and what? What did we discuss yesterday? Clinical feature and what?
Diagnostic evaluation
Yes, of what? Of urinary tract
of urinary tract.
infection. Okay, okay. Okay, today I'll be teaching you all on the complication as well as the management and the health education. First of all, the complication is first complication. There are lots of complication, but it's not that much necessary. So I will be giving you the 2 points. The first complication is the pyelonephritis. What was pyelonephritis, which I have already explained on the first day? What is pyelonephritis? Bhaboklam, what is pyelonephritis, which I already explained? This is the first complication of UTI. Bhaboklam, what is pyelonephritis? Ishan, what is pyelonephritis? Pyelonephritis? What is pyelonephritis? Surajit, what is pyelonephritis? What is pyelonephritis? Say fast.
When infection occur in kidney.
It is known as pyelonephritis. Yes, yes, okay, okay. Okay, okay, very good. Longjam Nandeshwar is joining now. Okay. Okay, then the next is hematogenous spread resulting in sepsis. These are the 2 complications of urinary tract infection. Who's making noise? Okay, next I will be discussing about the management. The management of the urinary tract infection. The first management of urinary tract infection is the antibiotic therapy, like according to the sensitivity result. First of all, a wide varieties of antimicrobial drugs are given to this urinary tract infection. Do you have any idea what is antimicrobial drugs? Anyone? Srijana, do you have any idea about these antimicrobial drugs?
No, ma'am.
Anyone? What is antimicrobial? Sheetal, what is antimicrobial? See, they're sleeping.
I don't know, ma'am.
Anyone? If no one responds, I will consider him or her as sleeping. Anyone, what is antimicrobial? Ila Sara, antimicrobial?
I don't know, ma'am.
And what about other?
No, ma'am.
Anyone?
No idea, ma'am.
I think Samuel will know this answer.
No, ma'am.
I think Samuel will know this answer, right, Samuel?
No, ma'am.
Why? Antimicrobial drugs are okay. These are a type of drugs that kill or inhibit the growth of microorganisms. Understand? So much this Rifen keep on like. Okay, you understand what is antimicrobial drug? These are the drug, okay, that kill or inhibit the growth of microorganism. Understand? Yes or no?
Yes, ma'am.
Okay, you just need to respond how many times I need to say again and again. So these are like these antimicrobial drugs are given to like urinary tract infection patient. Understand why these antimicrobial drugs are given to this urinary tract infection patient? In order to kill the microorganisms or inhibit the growth of microorganisms. That is the reason why antimicrobial drugs are given to urinary tract infection patient. And here, like all the antibiotics, right? All the antibiotics are considered to be as antimicrobials, but means like whatever antibiotic that we find, understand, all can be considered to be an antimicrobial, but all antimicrobial are not antibiotics. That you need to know. Okay, this is the first drug that is available to treat the urinary tract infection patients. Okay, let us move on to the next. Urinary infection usually responds to drugs that are excreted in urine in high concentration, and a potentially effective drug should rapidly sterilize the urine and thus relieve the patient's symptoms. What does this second point say? That the urinary infection usually responds like to drugs that are excreted in the urine, means like the drugs that are means like that can be excreted in the urine are given to urinary tract infection patient. And then that is very much high in concentration, and a potentially effective drug should rapidly sterilize, means it should be rapidly sterilized in the urine, and this will help relieve the patient's symptoms. This is the second point. And for the number 2, for uncomplicated infection. First of all, for uncomplicated infection, uncomplicated means not that much serious patient. Not that much serious means like complicated and uncomplicated. I hope you understand. Complicated means like those patients who are very much serious, and uncomplicated means not that much serious infection. So, keep on joining. Okay, and then for here, for uncomplicated infection, first of all, what therapy you need to use? First of all, you have to give a first-line therapy for women with uncomplicated cystitis. What was cystitis? Shital, what was cystitis that I have already explained the first day? What is cystitis? What is cystitis? Shital sleeping? What is cystitis? Shital, what is cystitis? Cystitis.
Which effect on the bladder, ma'am?
With effect on the bladder. Samuel, is it correct? Samuel, is it correct?
Yes, ma'am.
Okay, okay. First of all, like for uncomplicated infection, if the infection that occurs is uncomplicated, then first of all, what we need to do is that first-line therapy should be given to a woman with uncomplicated cystitis, including 5 days course of nitrofurantoin. Have you ever had this? The name of this drug, nitrofurantoin? Nitrofurantoin.
No, ma'am.
No, ma'am.
Okay. Virginia, do you know what is nitrofurantoin? Virginia, Malvina.
No, ma'am. No,
No,
ma'am.
ma'am.
Okay. Surajit, you know? I think Surajit is very excited to reply the
No,
answer.
ma'am.
Right. I think you know, Surajit. No need to feel shy. You say. I think you know the answer.
No, ma'am.
No idea.
No, ma'am.
Nitrofurantoin. These are the these are also the medication that is used to treat or else prevent certain urinary tract infection, because there might be a lower urinary tract infection, there might be a upper urinary tract infection, isn't it? Infection might occur in the kidney, it might occur in the bladder, it might occur in the ureter, it might occur in the urethra. So whatever infection that occur in the urinary tract, understand, all those are treated or prevent with the help of this medication. And the name of that medication is nitrofurantoin, and it is considered to be a first-line drug. And this is a 5-day course. That means like if a person is prescribed to this medication, then he have to take this for 5 days. For 5 दिन के लिए ये medication दिया जाता है, like 5 days के लिए. So in fill in the blank, or in exam, if I gave you that name the first line therapy which is given for a woman for 5 days course, then what answer will you give? First line therapy for women in not complicated cases, for uncomplicated cases for 5 days course. One medication a person need to have?
Nitrofurantoin.
Nitrofurantoin. Okay. This medication is antibiotic. This is also an antibiotic. What does this do? That this also same thing like that of the previous one. Understand this one, antimicrobial. This is also same. It also kill or help stop the growth of bacteria. These medications it is very much helpful. And again, there is also a 3-day course of medicine that is taken as first line therapy. That is Cotrimoxazole. Have you ever had this? Cotrimoxazole? Cotrimoxazole?
No, ma'am.
Means like, as far as I know, this Cotrimoxazole, no? It is like, it is the, the combination of the 2 drugs. One is the trimethoprim and one is sulfamethoxazole. This is the combination. It's not that much required for you all, but I'm just mentioning that Cotrimoxazole, it is the combination of the 2 drugs. One is the trimethoprim and the other one is the, what was the name? Sulfamethoxazole. And it is the class of medication called sulfonamide. And this is also same, like how the nitrofurantoin, how it works. No, it is same. It also stops the growth of bacteria. And this is the course is given for 3 days. And and there is also another 3 days course. The name is the fluoroquinolone. This is fluoroquinolone antibiotic? Is fluoroquinolone antibiotic? Sujana, is fluoroquinolone antibiotic? It is also a 3 days course. Seems like same like
Ma'am,
no idea. Okay. The name of this is the a 3 days. It is also given as a 3 days course. Okay, fluoroquinolone. The one of the example of it is the name of the group of drug, and the name of the drug that comes under fluoroquinolone is ciprofloxacin. Understand? Ciprofloxacin. And simply you call ciprofloxacin or ciprofloxacin. This is the name of the drug that comes under this group, fluoroquinolone. Understand? Fluoroquinolone, these are also an antibiotic that are, commonly used to treat a varieties of illness, such as like respiratory tract infection, urinary tract infections. So like, and there are also certain medicine or antibiotic that comes under this fluoroquinolone, not only ciprofloxacin. So many: ciprofloxacin, levofloxacin, moxifloxacin, norfloxacin, ofloxacin. So many drugs are there that comes under these fluoroquinolones. But I mentioned mainly this ciprofloxacin because so many drugs you won't be able to memorize. That's why, like, this is also a 3 days course. And it is also an antibiotic that usually treat varieties of illness like urinary tract as well as respiratory. This is also given, and it is very much effective. But what happens is that when you give this fluoroquinolone drug, that is like ciprofloxacin, you need to be very much careful. Like, you need to assess the consideration should be given to side effect. Means you have to, once you give this drug to the patient, then you have to, like, first of all, think about the consequences, the side effect. So the side effects like nausea, vomiting, so many things can occur now. So it is it is given only in certain cases. It is this class of, that's why in the last I have mentioned that this class of drug for other more serious infection, it is this drug is mainly prescribed. These are the like 2 points that come under management. Let us again revise. First of all, antimicrobial drugs are given. Then after that, for any drug that can be excreted in the urine in high concentration, that is given in order to relieve the symptoms. And the other one is that if there is any uncomplicated infections, like first-line therapy for women with uncomplicated cystitis, that means if a person have infection in the bladder, then you have to suggest all this first-line therapy. First of all, like 5 days course of drug is given, and the name of that drug which you need to give for 5 days is nitrofurantoin, and the other one which you need to give for 3 days course, that is Cotrimoxazole. And the other one, there is also other antibiotic that can be given in more serious patient, that is a 3-day course of a fluoroquinolone such as ciprofloxacin. These are the like the 2 management till now I have explained. And let's move on. Babakulak is joining now. It's already. Okay, then all those therapy, all those drugs, you know, like how it need to be given. Now let us see how it is being recommended. 7 to 10 days of therapy are recommended for women over the age 65 years. Means like I have already shown you here now, like for this, there is a 5-day course. Again, there is a 3 days course. I have already shown to you, but here it is mainly mentioned for advanced age. Means like for advanced age means for the old age, how this therapy how this drug and all need to be given. First of all, 7 to 10 days. Before it was 5 or 3 days course, right? But for women who are over the age of 65, this therapy need to be given for 7 to 10 days. This is for women. And talking about the men are treated with men are also treated with 7 to 10 days of antibiotic therapy, same like that of the women who are over the age 65. So now let me ask you, women who are over the age of 65, they are the therapy is recommended for how many days? The therapy is recommended for how many days? Ishan, the therapy is recommended for how many days? Women who are over the age of 65.
7 to 10 days.
Yes, 70. Samuel, tell me, antibiotic therapy are mainly recommended. These recommended for men for how many days?
Ma'am, 7 to 10 days.
Okay, very good. Again, number D point, that is follow-up culture to prove treatment effectiveness may be indicated. Do you know what is follow-up? Follow-up, anyone? What is follow-up? Follow-up, anyone? 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 Malvina, what is follow-up? Malvina, what is
Ma'am, following.
follow-up? What is follow-up? According to you, what is follow-up? According to you.
Ma'am, I don't know.
What about other anyone? Anyone? Anyone have any idea? Follow up. Suppose, let me give an example. Suppose you went to a chamber or a hospital for treatment, okay? And then the doctor suggests you, or the physician suggests you, that you have this medicine for 1 month. After that, suppose you have this medicine for 1 month, then after that you come back to me for re-checkup. Understand? Then the doctor said like that. That means like that is follow-up. Follow-up. Follow-up means regular checkup. Understand? So if you do this regular checkup, then this treatment will be very effective. And this is the another management in uncomplicated cases. Do you know what is follow-up culture now? This follow-up will improve the treatment. You understand what is follow-up? Follow-up. Samuel, explain what is follow-up. What is follow-up? Explained. Just now I explained what is follow-up. Just now I explained follow-up. Shital, help. You help.
Regular treatment.
Yes, regular treatment. Regular treatment, because you already went for a checkup once, isn't it? You already went for a checkup once, and so many medication are given to you. You already took that. You already had that. After that, the doctor will advise you, please come back after 1 month, after 1 week, after 3 days, after 4 days, because whatever medicine he had given you, now whether that is effective or not, he want to assess that. That is known as follow-up. चेकअप करने के बाद like वापस फिर से दोबारा treatment is better or not, to recheck it, that is known as follow up. And this is very much important to check any to check the effectiveness of any treatment. Next is you have to assess the adverse effect. Adverse effect means what? Adverse effect means the side effect. Means you have given the medication, you have taken the medication, but in the same way you also need to assess the adverse effect, the side effect. Means some medication like some medication now it can also cause nausea, diarrhea, and there can also be a rash in your body, that is drug related rash, and there can also be a vaginal candidiasis, all this. You understand what is the adverse effect means? Sujana, what is adverse effect? Adverse
Ma'am,
effect?
side effect.
Yes, the side effect. What side effect can you see?
Ma'am, nausea, diarrhea.
Diarrhea, and then what? Drug-related rash. Okay.
And
Okay. And then those like drug therapy, like the pregnant women are also given, and these pregnant women, they are usually treated for 7 to 10 days. Remember this, pregnant women are usually treated for 7 to 10 days. Only 10 minutes left. And then for severe discomfort with voiding, do you know what is voiding? Voiding, voiding. Do you know what is voiding? Voiding. Do you know what is voiding?
No.
Okay, voiding. Void means to urinate. Understand? To urinate. समझ में आया? Yes or no? समझ में आया? Voiding means to urinate.
Yes, ma'am.
Okay. For severe discomfort with voiding, like while urinating, there might be a burning sensation, there might be a discomfort, all this. In that case, in all those cases, what type of drug you need to suggest? What type of drug you need to suggest? The name of the drug is phenazopyridine. This phenazopyridine drug, this may be ordered 3 times per day for 2 days. Like 2 दिन के लिए ये drug देते हैं. Like in 1 day, you have to take 3 times. That is TDS. In medical term, we simply call it, we simply write it as TDS. That means 3 times per day. Means दिन में 3 बार खाना है. So, and this drug is suggested for 2 days. Understand? And this drug is given for severe discomfort with voiding. Means while they urinate, they feel discomfort. That is the reason why the physician or the doctor used to suggest to have this drug. And the name of the drug is phenazopyridine. And it is given 3 times per day for only 2 days. Only 7 minutes left. Srijana, keep on taking the attendance. Okay.
okay, ma'am.
Okay, next is the health education. Health education is very, very much important. Health education. First of all, health education, what you need to do this. If I won't be able to complete this this class now, means after this the time is running out, I'll be sending you the link again. Please do join it again. Because I have 2 class now, 3:15. I think no one of you will want to take at 3:15. So it's better if I continue with this before your Noksam ma'am take your class. health education. First of all, what health education you need to give to the patient? You have to instruct the patient to void frequently, means to urinate frequently. To urinate frequently means you have to patient को बोलना है कि हमेशा urinate करने के लिए, हमेशा like toilet जाने के लिए बोलना है. That is at least every 2 to 3 hours you need to instruct the patient to void. At least every 2 to 3 hours. And also to empty the bladder completely means when you urinate, like when you urinate, what happens is that means like if you don't urinate fully, it means if your bladder is not empty fully, then what happens? That will bring discomfort. So make sure that you empty your bladder completely when you urinate. Because when you empty your bladder completely, you know what will be helpful. This will enhance bacterial clearance. Means you empty your bladder completely. That means means the bacteria that are being accommodated there now all will be clear. And this will reduce your urine stasis. Means जो urine retention, urine stasis का मतलब है urine retention. जो urine retention ना, that you can't pass the urine ना, all those urine retention, that all those, this will enhance. And then it will also prevent reinfection. Means infection already occurred before. It's not infection already occurred. So in some cases, there is a great chances of having reinfection. Means dubara infection hona. Means before you got infected, urinary tract infection, and you ate so many medications, so many antibiotic, and your means what to say, your treatment course is already over. But still after that, after healing, after 2 to 3 months, again you are infected with that same infection. So all these, if you empty your bladder completely, then this will help you prevent even the reinfection. माने दोबारा होने का chances बहुत in some cases ना दोबारा होने का urinary tract infection ठीक होने के बाद भी दोबारा होने का chances बहुत ज्यादा होता है. इसीलिए अगर bladder को completely अच्छी तरह empty करने से क्या होता है, वो दोबारा जो infection हो सकता है ना, उसमें भी prevent करता है, as well as जो bacteria accommodate हो जाता है ना, वो वाला भी clearance होता है. So it is very, very much necessary to empty the bladder completely. All these are the point that you need to instruct to the patient. And then infrequent voiding. Infrequent voiding means like infrequent urination. कभी-कभी urinate करता, कभी-कभी नहीं करता. So infrequent voiding. If there is infrequent voiding, then there will your bladder wall will be distended. Understand? Because you are not urinating like fluently, isn't it? So your bladder wall will be distended. And if your bladder wall is distended, then what will happen? This will lead to hypoxia. Hypoxia means what? I already explained before. Hypoxia means what? Srijana, what is hypoxia? Hypoxia. I already explained this many times. Hypoxia.
Ma'am, forgot.
Oh, forgot. Hypoxia means what to say, like hypoxia means it is a condition in which there is a complete deprivation of oxygen supply. Oxygen supply कम हो जाता है. Understand? That is known as hypoxia, leading to hypoxia of bladder mucosa, which is then more susceptible to bacterial invasion. Means bacterial जमा होने में बहुत ज़्यादा chances होता है if there is infrequent voiding. This is the health education that you need to give to your patient. This is the first point. Okay. Only 2 minutes left. Srijana, done attendance?
Yes, ma'am.
Done. Okay. Let me repeat the point. After that, whatever point is left,
Yes, ma'am.
after this, the time run out now, I will directly send, means already that link I have sent now, you can directly join on the link. I don't need to send again and again. Let me repeat this. First of all, you have to instruct the patient to urinate frequently, that is every 2 to 3 hours, and also to empty the bladder completely. Kaboglang is joining now. Seriously? You have to instruct the patient to urinate frequently, 2 to 3 hours, and also to empty the bladder completely, because this will help you in clearance of any bacteria that can occur, and also it can reduce urine retention, and also it can prevent reinfection. Only 1 minute left. Okay, after this class is end, you directly join again with that link. "25 participants."